So today we're just going to take you guys through kind of the basic steps of a physical exam. Every doctor is going to look at the same things. We might do it in a little bit different order. That's a little bit personal. But we're all going to do the same things. We just want to let you guys know kind of what we're looking at and what we're doing. So Omaha, thankfully, is very food motivated, very sweet, so that makes our jobs very, very easy. But we have a variety of treats available to try to help keep your pet happy while we're doing this, okay? So the first thing we're gonna do is actually we're just gonna look from a distance, and we're gonna watch how are they breathing, if they're walking around the room, how are they walking, do we see signs of fear or anything that would suggest that they're painful, holding themselves stiff, uncomfortable, trying to sit down or lie down or anything like that. So the first thing we're gonna do is gonna look from afar. So we already kind of did that with Mr. Omaha, so we're gonna get started on the hands-on part. So what I like to do is kind of start with the lymph nodes when I've got a nice cooperative patient. So I start with these ones kind of right up here along your salivary glands. I'm going to check those. I'm going to check these nice ones right here in front of your shoulder blades. And then the armpits. And then we work our way back. Oh my, can you stand up? Up. Up, all the way up. He's like, but I'm sitting for my treat. Good job. No, don't sit, Omaha. Good job.
Boy.
I'm going to check these ones right back here in the inguinal area and behind the knees. So all of his feel nice and normal. And then I'm going to feel the belly. So I'm going to start kind of on the lower front half of the abdomen, and I'm feeling for the liver, the spleen, making sure I don't feel any abnormalities, no pain. The digestive tract feels normal, and I kind of work my way up high and tight for those kidneys. Then we feel the back half, feeling the intestinal tract again, and the urinary system. So feeling the bladder, except for Mr. Omaha peed recently, so we can't feel one. Kind of run my hands over, check for symmetry and asymmetry, okay? And I'm going to take a good listen, okay? So when we do this, we want to listen in what we call quadrants, okay? So we're going to listen first along in any order, but we're going to listen to the top half as well as the lower half of both lung fields. And we're also going to listen to the heart in 3 places on the left side and in 1 place on the right side. Because we want to make sure we don't miss any murmurs and that we hear all the way through the lung fields. If you bring your pet in for coughing or for respiratory issues, you might also sometimes see us take the stethoscope and listen right over the trachea to really assess those upper airways. We're going to listen for a good long while. While I'm doing that, I personally also like to feel pulse quality. So if I have a patient that's cooperative, I'll be listening, and I'm just going to reach right around on the inside of that back leg and feel that pulse. Make sure it's nice and strong and that the beats are matching with the heart rate. Okay? For an assessment of the muscular and the skeletal system, can you stand up, Omaha? One of the things we like to do is assess symmetry. So we want to take a good feel.
Stand up.
Good boy, handsome. We're going to take a good feel and just make sure we don't feel any joint swelling or muscle loss that might be on one side compared to the other. Sometimes, especially with this long, beautiful hair coat, it can be a little bit hard to tell just looking at them. So we want to take a good feel, make sure everything feels good. A lot of times we'll check reflexes, just to make sure, yep, fixes his feet right. We'll do that with all of them. And then we'll do the same thing up front, okay? Take a good feel of all the joints and the muscle mass. Make sure everything there feels good. And depending on what's going on with your pet, we might assess for some back pain too. So when we do that, you'll see us kind of push, and we usually do it when they're standing so we can get a better idea. I'll just put a hand under support so he doesn't sit down and think I'm asking him to sit. And I'm just putting moderate pressure along the spine. And he is a little bit sore today. You can see those muscles bunching. Omaha likes to jump in and out of the car. I wouldn't be surprised if he just pulled a little muscle, okay? And then I like to do the face last. Kind of depends on my patient. I find a lot of them get a little more nervous with forced eye contact, so I try to save it for last. So when we're up here, take a good look at the nose, look at the teeth on both sides. We're getting a nice solid, yeah, good job. So we want to look for any sores or any lesions in that mouth, any masses, anything we might be concerned about. Now we're going to take a good look at our eyes and our ears.
Sit. Good boy.
I know. So one of the other things we can do, if we have a pet that's a little more wiggly or that's a little more stressed, is use some of the high value treats that maybe take a little bit longer for our patients to go through compared to a biscuit that they might just swallow and not chew. So if we need them to hold still, we can use things like cheese.
Wait. Good boy.
Good job, Mama. Okay, so you can have some cheese,
Good
okay?
boy.
I'm just going to pull that ear out a little bit to help open up that canal, since their canal is kind of an L shape. I want to straighten it so I can see that eardrum. Good job. All right, can I see the other side? He's like, where'd the cheese go? Good job. I know, sorry. I know I'm tickling you, aren't I? Because you've got a lot of ear hair. Good job, Omaha. See, you're being such a good patient. Your ears could use cleaned. Huh. A little waxy, not too bad. And we're going to take a good look at the eyes. See what's that? You changed my life. See, just a light, no big deal. Oh, good boy. And when we're looking at the eyes, we're going to look at the interior of the eye, the back of the eye, if we can see it. We're going to look for any evidence of cataracts, any change to that lens, any redness of the eye, swelling, pigmentation on the cornea, color changes, anything like that. And obviously we're also looking for any kind of masses along the eyelids that might pop up. So we're going to take a good long look at that. So that's our basic exam. If we're doing a more complete orthopedic exam, sometimes we'll lay our patients down, do a funny little massage, run them through their kind of range of motion, so we can show you that really quickly. Down. Bring it down. He's like, what? Lay down. Lay down. Do belly rubs. Good job. Good job. So when I have a patient that presents with a potential lameness, I always start on the happy side first so that I can kind of gauge how comfortable they are and whether they're being stiff because they're scared or uncomfortable, or whether it's truly reflective of pain. So I like to start with the happy legs first. I do the same thing to all four. So first things first, I'm going to look at all underneath, in between the pads, and I'm going to look in between all the toes, and I'm just going to start moving all my joints, making sure everything feels good. Feel along the bone, check the ligaments, make sure I don't have any laxity or any crunching that might suggest some arthritis. Everybody knows those pops and cracks. Just feeling along that bone, making sure that there's any pain, all the way up to the hip. And we're going to give this a nice big stretch. Ready? Big kick. Oh, good job. Can you take it away? Can you take it? There, good job. The Omaha's a little too cooperative. Usually they should pull it away nicely. All right, we're going to do the same thing up here, okay? We would go through the exact same routine, checking all those joints. Ooh, you do have a pop there, huh? You're getting hard on yourself, Mr. Omaha, huh? Good job. Ready, big stretch, try to hit Nelly. Oh, Superman. Good job. Okay, can you take that one away? Oh, good job. Good job. And then if we were concerned, we'd go ahead and do the exact same thing on the other side. Again, we're assessing for symmetry or signs of discomfort on one side that we're not feeling on the other side to help us kind of clue in as to what might be going on. We can also check your patellar reflexes just like at your doctor. Hit the hammer, watch the knee kick out. We can check those on the front legs as well. Although in dogs, usually kind of pinching their toes and flipping their feet over to make sure they flip them back, or some of the more basic reflexes that we really can check and get good responses on. So that's what we do more frequently. Other than that, you can obviously, his chewing and swallowing are working fine. So that's a good thing as well. It's not an uncommon problem for patients to come in because they're not eating as well. So if we can watch them chew and swallow here, that helps us to know, are they putting the food to one side of the mouth or the other? Or does it seem like they're reluctant to chew? Or are they having problems with the swallowing process? That can also be diagnostic for us, as well as make for happier patients. So that's a pretty basic physical exam. Hopefully that helps you guys feel a little more comfortable about what we do and why and what we're checking for. You know, we want to make sure that everything feels good and there's no signs of pain or discomfort or any signs that would suggest any aging changes that we should be proactive and try to get going on. The other thing we would work on is weight control. So here in the United States, over 50% of cats and dogs in households are overweight and actually are classified as obese. So that's the other part of the equation we would talk about. Can you stand up, Omaha? So as an owner, what you can do to look for at home, and what we're going to look at here, is a waistline, okay? So they should have they should have a nice wide rib cage, and then as you bring your hands back, you should get a nice indent from a waist. And if the hair was a little shorter, you'd see it a little bit easier from above, as well as from the side. So you have a nice deep chest, and then you come up and you get this indent for your waistline here, okay? So Omaha's doing pretty well. He's got maybe a little extra winter love handle. Not too bad. Slightly overweight. But those are good things you can kind of monitor at home. And if you start to feel like your pet's losing that waistline and nothing else in the house has changed, you're eating the same amount, you're exercising the same amount, that might be a good reason to come see your veterinarian. Or if you're like, ooh, maybe I'm overindulging on the Christmas cookies along with my pet, that might be a good reason to get out there and enjoy some of the lovely Colorado weather. I hope that was helpful and informative. So now we're going to talk about cats. The basic physical exam is pretty much exactly the same as dogs. We'll look at a few additional things, but we do sometimes have to take some additional cares with our feline patients. They can stress out a little bit more frequently, especially since most of them already get a little scared just with the car ride. So we do have what we call a cat-friendly practice here. As you can see, we have a lot of wonderful toys and interactions for them that helps to encourage some playfulness. We've got some hiding under the chair over there. And we've got Feel Away. So Feel Away is a feline hormone, or pheromone I should say. You know how cats are always loving to rub their faces on everything. And that's basically marking to say this territory is safe. I've been here before and it's a-okay. So that's what that is. It's just to hopefully get that little bit of an edge so that the cats know, you know what, somebody else has been here before and they said it's all right. So we try that. Going along with that, another thing we can utilize is a nice towel. And sometimes we'll put a little extra Feel Away on that for our ones who are a little extra stressed. Get a couple sprays, get rid of some of that alcohol. All right, Miss Juliet, you want to come say hello? So Juliet's very easygoing and very sweet. So not too terrible for a physical, and can make it a little hard to demonstrate what we can do with some of our patients who aren't as excited to be here and be loved on. But one of the things we do with cats that's a little bit different than we do with dogs is kind of when we're watching from a distance, they're not as apt to be kind of moving around in the room and coming over and inspecting us and seeing what's going on. A lot of cats kind of just want to be sedentary, especially the more nervous they are. So we look more at their body language and try to watch once we do get them up to see if there's any asymmetries or any concerns there. When we're doing our physical exam, we're going to do the same thing, feeling for our symmetry, checking our muscle mass, checking everything there. And I would go through the same procedure I did with Mr. Omaha a few minutes ago. Additionally, with cats, we always want to kind of tilt their head up, and we're going to run our hands down their throat because they've got our thyroid glands are all in our throats, right along the trachea. And some cats can get a disease where their thyroid gland actually develops a bit of a tumor and starts to overproduce your metabolism hormones. And so in some of those cats that have that condition, we can actually feel enlarged thyroid glands. So we're always going to feel for what we call that thyroid slip, meaning we can actually palpate that nodule kind of slide past our fingers. That's one thing we're going to do in a cat that we're not going to do in a dog. So same as in dogs, we're going to look at their teeth. Not all cats are amenable. Not all dogs are amenable to it either. So sometimes you might see a veterinarian say, you know what, I don't want to risk my fingers and I don't want to stress my patient any more than I have to. So we're going to use handy dandy tongue depressors. So what we'll do sometimes is just barely lift those lips if she didn't want to mark the stick. Juliet says that's mine now. Huh. Good girl. We're just going to lift those lips a little bit so we can get a quick peek at those teeth. Good job. Good job. And then we do the same thing on the other side. So that's for our patients who aren't as happy with our hands in their face. Other things we can utilize is helping them hide. So cats a lot of times really like a hide space, and we can use our towel for that. Or if they come in a carrier, we can sometimes keep them in their carrier and do a good portion of their exam in that. Especially those hard plastic ones, because we can just kind of take the lid off and do what we need to do. Will you lift her up 1 second? So those cats that are kind of moderately stressed, you can set her back down. What we can do is actually just kind of drape whole towel, okay? Obviously we can't see as much of them then, but we can still get a good feel of everything. And this way they're hiding, they feel a little bit safer, and we can kind of selectively work on what we need. And if we need to, you know, give a vaccine and we need access to a leg, we've got that. Or if we need to draw blood, we can kind of keep them nice and pillowed down. I know you don't like to hide, and we've still got access to a good vein. Juliet, on the other hand, is a social butterfly, so she doesn't like to hide. For our really scaredy cats, sometimes we'll do what we call a kitty burrito. All right, Miss Juliet, I know you would much rather be snuggled. Good job, pretty girl. And what we do with that is just like you'd think about with a taco or a burrito. We're just gonna wrap that bottom. So let's say we want access to the front half. We wrap the bottom, wrap one of the sides over, wrap another side over, and we still have this beautiful face that we can deal with. And we've got those front legs if we need to draw a blood sample or if we need to trim nails or anything like that. And then we can do the same thing with kind of the back half. And that, for some cats, that just makes them feel a little bit safer. Kind of the idea of swaddling an infant takes away some of that, I know, some of that outside stimulation that they sometimes feel overwhelmed by. So those are some of the big fear-free initiatives we like to do here. We also have treats. Juliet's on a diet, so she can't have any, but we also encourage treats. And if the owners know that their cat's a little bit picky, or dog owners know that their pet's a little bit picky, they're always welcome to bring some of their own treats from home, because we want to make sure that we try to make it as comfortable and as efficient and painless as possible. So those cats that we see, they're already, we come in and they're already hiding in the corner, the last thing we want to do is push them over the edge where they feel like, you know, their only option is fight or flight. We definitely want them to feel like, you know what, this place isn't so bad, and hopefully have a better experience every time they come. We also have a wonderful new computer application called Cat Painting that some of our patients have thoroughly enjoyed, which just gives them an opportunity to show their artistic side. They can kind of choose their paint and then tap on the screen or paw on the screen, and it creates an art. And as you can see from our beautiful wall, some of our patients really love it. And that's just another way to engage your cat and provide another opportunity for them that they might not get at home. Try to take their mind off of all the scary stuff that we're doing to them. So, like I said, other than that, everything else in cats, physical exam wise, is going to be the same.